Good evening. Welcome to the Telehealth Education for Your Health Awareness Campaign Talk Series, the FACTS Initiative for 2020-2021. This is an inaugural virtual public health education program brought to you by an academic community partnership among the International Community Initiative, the Maryland Rural Health Association, and the University of Maryland Eastern Shore School of Pharmacy and Health Profession. My name is Huayan, and it's an honor for me to serve as your host for this evening and for future programs. A little bit about the organizer and partner of the FACTS initiative. Among the ICI, the Maryland Rural Health Association, and the UMES School of Pharmacy and Health Profession. In the interest of time, we invite you to visit the website of the three partners to read more about our mission and our work. The FACTS Initiative 2020-21 has a mission to promote healthy habits and raise health awareness through an interprofessional collaboration and telehealth delivery of health information for the community. Our goal is to provide accurate health information, resources, and strategies based on selected health topics of the National Health Observance to promote health and prevent disease. This will be a monthly 30-minute telehealth education episode bring to you via the YouTube channel starting in September 2020 and presented by a variety of health care professionals. For more information and or to volunteer for this program, the FACTS Initiative, please contact myself or Ms. Laura Wilson, the Executive Director of the Maryland Rural Health Association. Did you know that September is Healthy Aging Month? It is also National Preparedness Month, as well as National Suicide Prevention Week earlier in September. It is in that spirit that we bring you the first episode called Depression, Older Adults, and COVID-19, presented to you by Dr. Sharon Saunders. Next month, October, is Breast Cancer Awareness Month. We will also bring to you on the topic of breast cancer awareness. For today's program, and without further ado, I would like to introduce you to Dr. Sharon Saunders on the topic of depression, older adults, and COVID-19, what we can do to help. Dr. Sharon Saunders is a board certified in internal medicine and with added qualification in geriatrics. She is also a member of the Maryland Commission on Aging and the Maryland Response Medical Reserve Corps. She was recruited by Baltimore County Health Department of Health to help with the opiate epidemic. Recently, she also became involved with COVID-19 pandemic. Welcome, Dr. Saunders.
Thank you, Dr. Truong. Hello, I'm Dr. Sharon Saunders, and it is my pleasure to present the first lecture of the FACTS Telehealth Series. We hope you will join us monthly as we bring you topics to enhance your lives through a virtual public health education program. Next slide, please. Today's program is titled Depression, Older Adults, and COVID-19. What can we do to help? During the course of today's presentation, I will provide you with definitions. What do I mean when I say depression? Who is an older adult? And what is COVID-19? Some of these terms may be known to you, but I would like all of us to have the same meanings at the start. I will discuss depression risk factors and the signs and manifestations of depression as they pertain to older adults. I will cover isolation and loneliness, especially that which is related to isolation, and resources for depression, isolation, and loneliness will round out the presentation. Next slide, please. When speaking of depression, one can refer to the clinical diagnosis of depression. This is given the term major depressive disorder and is chronic or long-lasting. It often has improvement and worsening of symptoms over years and requires professional treatment. Situational depression, on the other hand, is usually caused by difficulty adjusting to the change in circumstances to one's life after a traumatic event. Situational depression is typically not long-lasting, but it can be of varying duration. Loneliness refers to the feelings of sadness, isolation, and abandonment felt when we are not in contact with those who are important in our lives. It's a subjective feeling, meaning that some people may feel lonely if they don't see or hear from a loved one every day. And for someone else, they may not feel lonely as long as someone checks in weekly. And who is an older adult? The agreed upon age is not exact, but a person who is 60 to 65 years of age and older is usually accepted as an older adult. I tell my children that since I have become eligible to shop during the early morning hours reserved for older age groups, and I can enjoy savings on certain days reserved for older people, I am proud to be an older adult. Next slide, please. Let's have a short discussion of COVID-19, as I am sure many of us feel we know much about this unexpected pandemic. COVID-19 is a disease caused by the SARS-2 coronavirus. SARS-1 caused a significant respiratory illness in 2003, but not nearly on the same scale as SARS-2. Much is yet unknown about this current coronavirus. Several vaccines are currently undergoing human trials, and the hope is that the vaccine will be available at the end of 2020 or at the beginning of 2021. At this point, wearing a mask, adhering to strict physical distancing of at least 6 feet from other people, and isolating infected individuals are the best practices. Next slide, please. During these times of COVID-19, risk factors for depression, which can affect older adults at any time, can be especially likely to have an impact. The older individual is more likely to have a chronic illness, which can put them at greater risk for being infected with the virus and have a more severe course if they do become infected. The associated fear of this happening to themselves or to loved ones can be a heavy burden. The older adult who has experienced bereavement, such as the death of a loved one, particularly if this person was a source of regular support, can contribute to loneliness and depression. During COVID-19, everyone's mobility has been limited, and this can impact older adults particularly hard. There may be physical mobility concerns that limit how far one can walk in or outside the home, and transportation, especially public sources such as mobility vans, is limited for an unknown duration. Sensory impairment, such as decreased vision or hearing, which occur more often as we age, can lead to less information being available to the older adult. Knowing that one is missing information is of concern at any time, but particularly in times of crisis, and can contribute to stress and the feeling of isolation. For those older adults who maintain a job, even part-time, the limits placed on retail shopping and dining may have resulted in economic instability. This can contribute to depression. Loss of routine, particularly as it interferes with the older adult's ability to connect with others, such as being unable to continue activities at the senior center or attend an exercise group or worship services, and to share meals with friends through congregate dining opportunities, can lead to the feeling of isolation, which can contribute to depression. Next slide, please. I would like to highlight 2 risk factors for depression, one of which makes us aware that anyone can be at risk for depression, and one of which notes that there is an increased risk for people with a family history of depression. Isolation can happen to anyone and at any time. As we become older and perhaps have a chronic illness, which makes living at home unsafe, an individual may reside in a nursing home. During COVID-19, to protect older residents with fragile immune systems and health Friends and loved ones were kept from visiting. If the older adult became sick and had to be admitted to the hospital infection unit, this isolation was even more stringent. The isolation imposed because of COVID-19 often could be the tipping point to cause the older adult to feel depressed. Depression during COVID-19 can be felt particularly by marginalized populations who already experience feelings of isolation. Members of the LGBT community, immigrants who may have economic and language barriers during normal times and which become magnified during times of crisis, and racial and ethnic minority groups which experience health and day-to-day living disparities which also are made worse during times of crisis, such as the current pandemic. And what about people who have a family history of clinical depression? Twin studies suggest that 40 to 50% of depression can be traced to an inherited source, and family studies report there is a twofold to threefold increase in the lifetime risk of developing major depressive disorder among first-degree relatives. And that means some people such as your mother or father, sister or brother or children. Next slide, please. As you will remember, my first slide included, what can we do to help? Those of us who have older adults in our lives, family, friends, or neighbors, should be aware of the signs which might indicate that the older adult is experiencing depression. These signs may be obvious or they may be subtle. So making note of changes over time will assist you in recognizing that the individual's usual ability to cope with the changes in his or her life is reduced. Let's expand on each of these. Next slide, please. Look for a change in the older adult's sleep pattern. Is it more? Is it less? What about their appearance and self-care? Do they seem not to be bathing, or are they wearing soiled clothes, or they're not maintaining their grooming? How about their appetite? Are they skipping meals? Do they seem to be eating less? How about losing weight? Maybe their clothes look like they're hanging on them. And is the refrigerator empty or the cupboards? Mood is also a very important sign. Are they less interested in life? Or maybe they're just more angry. They seem to have less pleasure in activities which they enjoyed before. Is the older adult drinking alcohol more, or are they drinking earlier in the day? The trash may give clues regarding the amount of alcohol which is consumed. You might see bottles in the trash. Is the older adult smoking more? Is there evidence of more cigarette butts in the ashtrays or in the trash? Or are there more empty cigarette packages than usual? Depression can appear as an early decline in cognitive function. What I mean by this is that if the older adult is depressed, he or she might take no interest in the world around them. If they are asked to name the current day, the person might say to him or herself, "Today is the same as yesterday and the day before. I don't care what day it is today." They may appear to be losing cognitive function when their response is a reaction to their feeling that their life has little or no meaning or interest to them, and they do not wish to engage their thoughts or efforts to be an active participant in their current surroundings. Depression, either major depressive disorder, which might be worsening, or situational depression, may require intervention to arrive at the correct diagnosis and begin appropriate treatment if needed. Make an appointment with the older adult's primary care provider, or if they have a mental health provider, contact that individual to make them aware of the change in the older adult's condition. Next slide, please. Next slide, please. There are approaches older adults can take to prevent the onset of depression during COVID-19. Getting enough sleep is important. Most studies recommend 7 to 8 hours each night. Engaging in regular exercise, even if it's just stretching and walking inside or outside, making a circle around the house. Eating healthy, well-balanced meals. Cutting down or discontinuing alcohol and caffeinated beverages such as coffee or tea. Taking frequent breaks and using relaxation techniques such as deep breathing. Limiting exposure to information which causes stress. Watching the news all day can become a habit, which over time might add to our emotional burden and which can contribute to depression of which we might not be aware. Friends and family can play a large role helping older adults cope at this time. Be aware of your older neighbors and ask if they need help. Be specific. If you ask, "Do you need help?" you will often hear, "No, I'm fine." A better approach is to say, "I'm going grocery shopping. Can I pick up some vegetables for you?" Next slide, please. If your older friend, actually, let's go back to the last slide, please, Dr. Trong. Thank you. If your older friend or family member has access to and is comfortable with technology, use FaceTime. A phone call can work just as well and may be less of a challenge to the older adult. Encourage the older adult to continue routines. Many activities such as worship is available online or by the phone. If the older adult has access to technology, attend a museum tour virtually with them. With you on your computer and the older adult on theirs, you can discuss the exhibits over the phone. Encourage the older adult not to make major life decisions which may be influenced by fear or depression. Join the older adult in trying something new for both of you, such as meditation or brain challenges. Doing it together allows the older adult to feel they are on equal footing with you, and you can share the fun of discovering a new activity. Speaking of meditation, did you know it has added benefits, such as lowering blood pressure? Start slowly with 5 minutes of meditation, and then work up to 15 or 20 minutes. Ask the older adult in your life to share stories of resilience. Remember, these are people who have come through former hardships, such as war and economic depression, and they have much wisdom to share with us. Remember that there are support groups and other forms of assistance available. Reach out to them as needed. Next slide, please. I have included several resources, including local, state, and national organizations. The county departments of aging are ready and able to provide help for older adults. If you have internet access, type the county: Anne Arundel County Department of Aging, Baltimore County Department of Aging, and so on down the line. You can also call 211 and they will connect you as well. Maryland has several organizations which can provide assistance for older adults. If you type in aging.maryland.gov, you will see a very vast array of services available. There is Senior Call Check, which is an automated daily call that is free to Maryland residents age 65 and older. You can call the 800 number, which you see on your screen, or again, access aging.maryland.gov. Maryland Access Point for seniors provides certified information and assistance specialists, and they are available from Monday through Friday, 8:30 to 4:30 p.m. Community for Life provides services to support older adults as they age at home. Core services include service navigators, who are individuals who receive training to assist older adults, transportation and home maintenance. Shepherd Pratt provides virtual and in-person care options. Their virtual crisis walk-in clinic is available to any individual living in Maryland. Next slide, please. Johns Hopkins Medicine has online resources and tips for dealing with social isolation. There are several national organizations as well, such as the National Alliance of Mental Illness and also AARP. Many of us have enjoyed being a member of AARP to receive discounts on many items, but through their community connections, you can also receive a friendly check-in call from a volunteer, or be connected to a support group, or receive assistance finding support within your community for chores which have become troublesome, such as walking your dog or getting food. Next slide, please. Some of these organizations are multilingual. SAMHSA, which is the Substance Abuse and Mental Health Services Administration, provides confidential and multilingual assistance 24 hours a day, 7 days each week. The call is toll-free. The National Council on Aging has resources specifically for older adults during COVID-19 as well. Next slide, please. Other agencies address needs of specific communities, such as the LGBT community and individuals with Alzheimer's disease. The Esperanza Center of Catholic Charities assists immigrants from around the world who require various types of assistance, but especially including assistance during COVID-19. COVID-19 has affected the lives of all of us, but those whose lives already were limited by illness or lack of abundant choices in terms of living arrangements or mobility, or by language barriers and economics, have been impacted most. Older adults are often part of this significantly impacted group. The increase in isolation and loneliness, and the decrease in routines and healthy living and eating can result in depression. While there are resources available to address depression, it is up to those of us in the community and who have older adults in our lives to be vigilant in monitoring the older adult and recognizing the signs and symptoms which indicate that care, either professional or increased involvement by us in the older adult's life, may be needed. Next slide, please. Thank you for your attention. I would like to discuss at this time now some of the questions that might be going through your mind as I've presented some of this information, and provide some ways of dealing with the situations which might come up as you work with your family member, perhaps, or your neighbors. I had mentioned earlier about being specific about offering help. And one of the things that you might do is to say to them, I'm trying a new recipe. May I bring you some and get your opinion? This has two benefits. You are gaining cooking skills, and I'm hearing that during COVID-19 that is actually happening a lot, but you're also feeding the older adult and getting their input, which makes them feel important. So you're talking about win-win. Another specific way to help them, especially getting food in the house and healthy food, is to say frozen vegetables are on sale at the grocery store. Have you got room in your freezer for 2 bags? What kind of veggies do you like? This is important because while this is the harvest time and we do have fresh fruits and vegetables available now, the frozen vegetables are the next best thing. Canned vegetables have a lot of salt, and so having the frozen is a better option. Another thing that you might say is to tell them, I'm picking up some groceries for my neighbor, Nana. I'm not certain what she or he would like. Can you go with me to help me shop? Or can you make some suggestions about what I might buy? By doing this, the older person, first of all, is feeling very important that they're helping you, but you're also getting an idea of what your Nana likes to eat. And therefore, when you go shopping, you can include that in your grocery list and surprise her when you stop by. Another thing which the Communities for Life includes this in some of their services is asking your older person, the older adult family member or friend, if they have any batteries which need to be changed. We know that flashlights are so important when the power goes out, but also make sure that smoke detectors are also, that you check into that, and ask them if there's any bulbs that need to be replaced. If they're not sure, ask the person if you can go and check these with them and make sure that they have what they need. And then the final thought is to, and it depends how brave you feel at being, but if you can find a YouTube version of the older adult's favorite song, learn to sing it and surprise them with your performance. Don't worry if you feel that you're not a good singer. It's your effort that matters. Afterward, then you can sing it with your older person. It's important that the good thing about having the song is that it can be done over the phone. It can be done standing with you outside their door and they're standing inside their door, or you can do it at a safe 6 feet physical distance. I hope that you've enjoyed some of the comments that I've made. I'm sure that you have probably lots of your own. And again, thank you for allowing me to present this lecture to you.
Thank you, Dr. Saunders, for a very informative and rich in information and resources for us and for the audience also. For those of you who are listening in the audience, whether via live stream or watching this YouTube video later, we hope you find these resources helpful, and hopefully you can apply the information and the tips that Dr. Saunders provides you to take care of your loved one, as well as all the older people around us. Thank you for attending the inaugural session with the three-way partnership between the International Community Initiative, the Maryland Rural Health Association, and the University of Maryland School of Pharmacy and Health Profession. We would like to remind you of the next episode in October, which is Breast Cancer Awareness Month. Please stay tuned for more information and the video for the FACTS initiative in October of 2020. Thank you for attending and have a good evening.